Hi, I'm Dr. James Johnson. This is another in the series of a masterclass in the management and treatment of eye floaters. I'm an ophthalmologist, and all I've done for the last 18 years, as of 2025, is treat eye floaters, primarily with a laser. So today, let's talk about the laser. And actually, I'm going to break this down into two parts. Part one, we're going to talk about some of the basics of the laser, the controls, the optics, some of the basics of laser physics, the energy profile, and some of the options. And we'll do that, some of this here, and we'll do some of it over in the treatment area. So first, I'll just say that my experience has been exclusively with LX lasers, LX now owned by Lumibird, but LX lasers. And I actually have two different lasers. I'll talk about that in another part of the video. But some people will contact me and they're like, do you have this specific laser? Or I read that this is the better laser. I tend not to get into a measuring contest. Oh no, my laser is newer, or I have the newest laser. I'm going to go out on a limb here and say there really isn't that much difference between the lasers. They all have more or less the same wavelength, frequency, energy range. The knobs and some of the bells and whistles will be slightly different from each other. But there's not that much difference between the two, or I'm sorry, between the different manufacturers. So if you're a physician and you have a YAG laser, you don't need to necessarily have the latest, greatest, newest laser out there, because these lasers are not designed for treating eye floaters. This is an off-the-shelf laser. These lasers are almost exclusively used for capsulotomies after cataract surgery. Occasionally used for a peripheral iridotomy, for emergent eye pressure control, but that's what the laser's usually used for, and that's what most cataract surgeons and most ophthalmologists will have access to the YAG laser for those purposes. I'm adapting it for a different purpose with a lot of modifications of technique and considerations, of course, but you may very well have a laser that can be used to treat eye floaters. So the latest, greatest is not necessarily the bestest. So with variations, of course, you're going to have some basic controls. You're going to have, it's going to be a slit lamp design, which means that you have a light source coming from the light tower here. And it is, instead of broadcasting a broad light, overwhelming amount of light, it allows you to variably narrow that beam of light. You can have a wide light, you can have a narrow light, and since we're trying to image a dark space back in there, we'll take a narrow beam of light and we'll send it through that, and basically it is like taking a slice of light through a dark gel, and it lights up this. So by moving that slit lamp from one side to the other, you can take visual slices and visual images of that dark space in there and give yourself a sense of that three-dimensional space. It's the same as our slit lamp examination, using a slice of light to look through the cornea and the lens and further back. So slit lamp design, the difference is in the head unit here, there is a laser. And the variable beam from side to side, the laser, the optics, and in this case, this has a joystick control. I think some of the very older lasers may have had a laser burst triggering device with a foot switch. I know some of the older LX lasers did. But I think most of them will have some sort of triggering device as part of that joystick. And it makes a lot more sense because you have a lot more fine motor, fine muscle control with your finger by doing this than you have to do recruiting large groups of muscles to use your foot pedal, and it's uncomfortable, especially when you're doing hundreds and hundreds of shots of the laser. There will be some sort of box or monitoring to give you feedback as far as what is your energy settings, what is your burst rate, what's your total cumulative shot count, as well as some various other controls and some engineering management and things like that. But that's about it. That's it. Now, one super critical component to this, or variable to this, is that the lasers may have either a tall tower or a low tower, and that is the light source that is coming up through this 45-degree angle up there and is going into the eye. It is either going to be a tall tower and it's going to be coaxial with the optics of your eyes here, or it'll be a lower tower aimed upwards. Well, if you're working towards the front part of the eye, you can have a low tower aiming the light up at that capsule, and it's out of the way, and you can put that tower wherever you want to, and that's fine. But when you're working further back, that light is just going to go on up and just illuminate maybe the upper part of the retina, and you're not going to be able to illuminate the vitreous there. So if your laser has a low tower, you really just can't use it. Now, it's possible, for instance, with the Ultra Q, I believe they have had some lower tower models, and so it might be possible for the manufacturer to switch that out. That might actually be an option depending on your preference. So if you have that lower tower, you may not need to replace the entire laser. You might be able to just get a modification, and all it is just a light bulb and a focusing control, a narrowing control, and a mirror. So that might be something that might be fairly easily switched out without having to change the laser at all. As far as the optics, these are it's analog optics. It's not digital or anything like that. And they appear to me to be fairly parallel optics. Now, what does that mean? Sometimes with microscopes, they can be convergent and they can be parallel. I personally have a little bit of a latent esophoria. So when I'm looking through parallel optics, it's a little bit harder for me. It's a little bit more work and a little bit more uncomfortable for me to get those images perfectly lined up there. I have to work a lot harder at it. So in my working lasers over there, I've got a way to sneak a little bit of prism onto one side here. It's about 3 diopters. It isn't much. Base end prism there, and that's a modification that could be done to the optics there. As far as the laser physics, I'm no physicist, I'm no expert, and it's not something that you really need to know the details of. You kind of boot it up and you aim it and you fire at your intended target. But this is a YAG laser. It's yttrium aluminum garnet. It's a solid rod that is surrounded by neodymium, and I've kind of represented this as this YAG crystal here, and the little dots here would be the neodymium. In this case, the laser is excited by an external flash tube, just like in a camera, big bright flash of light, and that stimulates it, and then that releases that laser energy. And as typical with lasers, there's 2 mirrors on both sides, so that gets amplified. That's the laser amplification part of it. And then there's a hole on one side that allows the release of that light. Now, the lasers that most of us would be familiar with are those that you've seen in every science fiction movie, the pew-pew lasers, single beam of light. Or maybe you have a cat at home and the cat chases the laser around the floor, and it's hilarious. And we do have argon lasers, as you know, that will deliver a single beam of light, and we can intentionally put thermal burns on the retina. Why would you want to do that? Well, if someone has a hole or a tear and you need to kind of spot weld that down to prevent that from ever detaching, we will want to very precisely focus laser energy on the retina and cause some thermal damage. That's the intention. We don't want that in the eye. And so the question mark represents some kind of magic, a black box magic that the laser engineers have figured out to take that single beam of light, they diverge that energy and then reconverge it, and that's where the magic comes in. So that laser doesn't come out of these lasers, the laser energy or the laser energy profile doesn't come out as a single beam of light. It comes out as a cone of energy. Now that's really cool because it only delivers energy at the apex of the tip of that cone, which is right there. So you can take that cone of energy and you can very precisely move that wherever you want, which is why this laser is on an XY axis as well as a Z axis up and down. So you can move that cone wherever you want into the location to deliver that energy. All right, so we're over here in the treatment area, and I wanted to demonstrate a couple of things with the laser here. And one of those, just to go back over it again, the laser has this cone-shaped energy profile. What I didn't mention over there is, as part of the focusing mechanism, and by the way, that energy, the YAG laser, that energy is invisible. It doesn't have a green or red light or anything like that. But as a focusing aid, in this case, along the top and the bottom of that cone are focusing beams. In the case of the Ultra Q, it's red. In the case of the Ultra Q Reflex, it's green. Same. Low-level energy lights, they're always on all the time. And where those two energy beams come together, that's the absolute and precise focus of that laser. Coincidentally, literally, the axis of rotation of that light illumination tower coincides with that focusing. So from this laser here, this is just a piece of tape I put up there, but there is a narrow vertical beam of light which can be widened. It can be made brighter. I dimmed it way down here. And what you would see is that those two red beams will come together right exactly where that beam is passing through. So both the light energy coming through at an angle as well as where those beams are focused, that's the precise location. And you might swing it off to one side or to the other, but they'll always coincide with each other. The duration of that energy delivery is in the nanoseconds range, 0.000000020, and it's focused down to about 8 or 9 microns, which is really small. And so it really is a very small amount of energy. And so in my practice, for my personal preference, I generally don't dial up the energy up or down. I have it kind of set where I like it, and generally don't do much for that, except maybe in the instance where I'm working a little bit closer to the lens, where I'm getting a little uncomfortable, I might dial down the energy just so there's a little bit less of this kind of surrounding small little shock wave that surrounds that focal point. But we have the controls for that, but I don't use that very much. But mostly you're putting that energy where you want to deliver that energy. It's a coordinated effort between the patient and the doctor and the location, and swinging that slit beam from one side, the optics from one side to the other, the slit beam from one side to the other. It's tough working in that backspace. So it is not just moving it where you want to. You have to sometimes have the patient look up and look up in this direction, or have the patient look down and try to get in that direction as well, kind of swing the laser over a little bit, but maybe have the light off to the other side. One of the big challenges, though, and I'll discuss a little bit more when I get over to the lasers there, is this light tower will block the energy right down the center. I've had to deal with that for 18 years. So you always have to have the light source off to one side or the other side, unless you have the LX Ultra Q reflex model that allows you to allows you to have the light source right down the middle, coaxial with your view, and when you fire the laser burst, that the mirror that would normally send the light to the back of the eye, that will drop down briefly and pop back up again. There are some problems with that I'll discuss later. That's the physics, the energy profile, which is the cone there. The options, mostly the options are adjusting the energy setting, which is either in millijoules, up or down. You can also adjust the burst per shot. So in other words, when you fire that trigger, in this case with these lasers, you can get 1, 2, or 3 bursts per shot. There's the YAG out of Switzerland can go up to 8. Although mine can do 3, almost exclusively, almost always it's 2. I have it set on 2 bursts. I think when you get into 3 and more, you're just kind of running up the numbers a little quicker without really delivering effectively more energy. You're just kind of running through the numbers quicker, faster, sooner. So my personal preference, you choose whatever you're comfortable with, but 2 bursts per shot. I'll discuss energy levels later. My personal professional preference is about 8 to 8.5 millijoules per shot. That's what the laser is sending out. That's what it's telling you it's delivering, but what you're actually delivering has a lot of variability. It depends on how far back you're working, how big or small a pupil is, if there's a capsulotomy size, or the size of if there's an implant lens, the level of cataract that they may have, any astigmatism or optical distortion or radiokeratotomy. Anything in the optics of the eye can affect how that energy is being delivered. And especially as you start to go more, not dead center, but you start to go more oblique through the lens out into the periphery, any number of things can affect how that energy is delivered. But surprisingly enough, I find myself not adjusting the laser energy up and down but by improving the optics. That might be some technical things or technique type of things like having the patient move their eye, look left, look right, try to move things around, try to get the floater to come more front and center. So rather than chasing it into the worst spot or the least effective spot, try to get the floater to move into a position. And that's some technique type of things, which I'll talk about in some other video as well. Well, I guess that winds up this video of part 1 of the YAG laser overview. Part 2 will be modifications that you can make to your laser for better patient comfort and maybe even better safety. Thanks for watching. If you think you'd like to watch more of these, you can always subscribe. You can hit the thumbs up, which helps the algorithm and helps other people find me. Thanks again for watching, and until the next time, have yourself a great day. In between the oculars and the laser body there, you can put a barrel magnifier. It just fits right there, and the oculars fit on that and gives you a couple of different magnifications. I don't use it. It comes with the laser. I don't use it. I don't find that helpful. I'm very accustomed to a particular magnification in my view, and more magnification or zooming in or zooming out really wouldn't help it at all.